Thank you for taking the time to view the DBMS system presentation. Here you will see a brief overview of the main features of the integrated care management system offered by DBMS. This is a short presentation, so we ask that you please hold all questions until the end of the video. This is an illustration of ICMS and all of its dynamic components. Our system encompasses everything from EMR, billing, claims, pharmacy, labs, vital signs and much more, with the abilities to integrate with existing claims and financial systems. The ICMS system is fed by a variety of different methods, but they are all loaded onto one database that feeds all components. Automated processes such as our reporting engine allow important reports to be generated within seconds, while our behind-the-scenes data mining ensures that all the necessary information is brought to the attention of the user without the need to search for it. Here is a brief list of the more than 30 components our integrated system offers. The DBMS system has everything from utilization management, to a universal EMR, offered in more than one language, an assessment and care plans protocol builder, clinical and medical guidelines, episodes of care builder, a reports builder, and write fax integration. Using eligibility, claims, and pharmacy data, in addition to the demographic information entered by the user, the DBMS system populates the patient profile to allow initiating activities such as telephone, fax, web, or electronic requests to begin the medical management process. The system allows users to electronically generate customizable care plans with problems, goals, and interventions. The system has over 500,000 possible combinations of problems, goals, and interventions to ensure that an appropriate care plan can be assigned to each specific and unique case. Management also has the ability to pull quality reports as well as risk stratification reports for members or entire groups. The system automatically pulls claims, pharmacy, and eligibility files electronically from a secure FTP site. The files then run through a downloader which automatically generates data mined outreach tasks and sends them electronically to the correct department, eliminating the need to have staff sort through patient files to find possible cases for either case management or disease management. Utilization review in the system is used to track inpatient and outpatient authorizations, denials, and even appeals. All diagnosis codes are run through a trigger diagnosis list in order to identify and refer high-risk cases to case management or disease management within our system. This is a brief list of the codes the system tracks. The advantages of this feature would be that all high-risk cases are identified automatically and the appropriate departments are notified to contact the patient to inquire about enrollment. This saves money by allowing you to provide preventative care early on and by tracking the case as soon as a high-risk code is entered in the system. In case management, the system allows the case managers to track patient activities and record unique notes with secondary material if required. The case management program also allows for the case managers to track all savings incurred for that case in the system. These savings can then be viewed per case or per the entire case management program in a report that I will show later on in the presentation. The system also gives the user ability to create tasks and schedule follow-ups within the system to help provide quality and guided care. Disease management is also followed in the system. This component allows users to track patient assessments, condition information, and permits users to perform care coordination at home or from an office setting. Patients eligible or patients suited for disease management are identified through various avenues in the system, and once in the program, their conditions are stratified by intensity and risk. The system offers various quality reports for specific members or for entire groups to give management a good overview of the conditions within the population. Some conditions the system mines for include asthma, CAD, and diabetes. The DBMS system has over 100 conditions and condition assessments incorporated into its health management services. After a primary patient assessment is complete, The system will automatically generate supplemental assessments based on the answers entered into the original assessment. With our dynamic assessment protocol builder, adding additional assessments is a breeze and can be customized to the needs of your institution. These assessments then generate a customizable care plan with the recommended problems, goals, and interventions for the patient. The care plan takes into account all the assessments and conditions the patient has and can be customized to assign priorities and add non-standard goals or interventions. Another great benefit of the ICMS system is the ability to auto-generate letters. There is an extended library of letters already available that can be customized for your institution, or we can even add additional letters you may require. Letters can be generated for an individual or an entire group by simply clicking a button. Our universal EMR component contains all the information necessary to keep track of all important patient information. All information is maintained real-time through HL7 technology and is completely integrated with our core system, ensuring universal access and the most accurate records. Here is a brief list with some of the reports found within the ICMS system. The complete library of reports includes internal and external reports that can be generated weekly, monthly, quarterly, annually, or on an as-needed basis. Additional reports can be added into the system if your institution requires one that is not currently found in our current report library. I will go some of our most popular reports now. Automated quality reports can be created and printed. These QA reports capture potential authorizations that will be rejected by the claims processing system. Making the necessary corrections prior to transmitting the authorizations or pre-certification data to claims systems will ensure that over 95% of the pre-certifications are paid from the time the first payment is processed. This prevents delays in processing claims and avoids Medicaid or Medicare penalties. This is our authorization timeline and state accreditation report. Here we can see a report of the authorizations done on the patients, the authorization type, the decisions, and denial reasons. This state report, as well as all the others, can be customized to show Medicare and Medicaid claims or claims from any other government program. Our quarterly medical necessity review report will determine how many medical necessity determinations were processed, during a date range you choose, along with how many denials were issued and how many of those denials were resubmitted and/or reconsidered and overturned. This is a great report for tracking and confirming those important activities. The UR Daily Status Report is an internal report that shows all UR or CM activity and notes for a specific time frame. You also have the ability to pull this report by user to see a total number of notes and referrals completed by that specific user. This report is great for tracking nurse productivity. Next we have one of our referral activity reports. This is the CM dashboard report that pulls all cases that were referred to case management based upon our UR data and the internal trigger diagnosis list. The Medical Management Report is a comprehensive external report that contains all UR, CM, and DM activities. This report is usually between 13 to 33 pages. Shown is the last page of the report that contains all of the savings reported for each department. Here we can see the total number of members, case management and disease management savings, and the total for both. The report also breaks down the savings into annual and monthly savings per member, and the percentage of saving compared to national average. We can also see the total claims expenditure and the average percentage of savings. The Disease Activity Report is an external report without PHI. This report breaks down all the disease activity within a population and also has a projected savings based upon participation in disease management programs. Here we can see how many members have each type of disease and the percentage of the population that number represents. The Risk Stratification by Condition Report is a breakdown of risk levels for conditions. Here we see how many members are at each risk level for the conditions being compared. Looking at the key, we find that green represents level 1 or low risk, while white is level 4 high risk. As an example, there are 163 members with asthma, and of those 34 are level 4, 27 are level 3, and there are 51 members at both level 2 and level 1. Next we will be viewing the first of 3 care plan reports. This is the complete care plan report, which is pulled on the individual. You can see the primary diagnosis along with any secondary diagnosis. It lists any contributing factors along with goals, goal dates, interventions, and intervention dates. Next we have a quality care plan report, which is the care plan aging report. This report lets management know how long care plans have been open for members and the care manager's name. This is similar to an AR aging report. The final care plan report is the care plan summary, which pulls all problems, goals, and interventions for an individual. It also shows us the status of each factor in the care plan, what the domain of each goal is, along with a record of the users who entered and updated the care plan. The episodes of care report is a gap in care report. This report is on diabetes and allows user to identify where the member is compliant in his or her care. The fields in this report are determined by key, comprehensive questions asked in the assessments done on the patients. The report then pulls the collected information and keeps track of the dates when the tests were done, the results, and notes on the methods. This is our episodes of care summary report. It presents a summary of the total members identified in each condition and breaks down the numbers into compliant versus non-compliant. It tells us what percentage of the members are enrolled in the disease management program, how many are receiving our patient education materials exclusively, as well the same information for those members identified with high-risk codes. This is great to get a quick overview of compliance for a particular condition in our episodes of care component. Next we have our disenrollment reasons by program report. This is a quality report used to track why members have been removed from their DM programs. It tracks everything from resolved conditions, duplicated patient records, dissatisfaction, and even patient death. Now we will be looking at 3 of the most important administrative reports currently in our system. This is our UR dashboard, which in this case was pulled specifically for diabetes. This is one of 2 dashboard reports, and it breaks down the costs of ER, office, and hospital visits by month for the specified condition. There is a risk stratification profile along the bottom, a breakdown of the population along the side, in addition to cost component breakdown. Next we have the pharmacy dashboard report. This report breaks down the costs of the pharmacy expenses by month or per member per month, the average cost of each prescription, the number of members on antidiabetics, the average number of days prescriptions were written for each month, and an average of the prescription cost per member. Along the bottom we see a top 10 list by cost, and a breakdown of this by top antidiabetics and top ACE inhibitors. Along the side we see the pharmacy summary with actual figures representative of the information shown on the graphs. Finally we have the current enrollment report, which is a comparison report of active and inactive members for a specific time frame. Here you can see in the first quarter active members are light blue and the second quarter active members are white. You can then compare active members between the both quarters for each condition, as well as compare the total number of active members to the current total of inactive members in each program. This concludes our system overview presentation. Feel free to ask any questions now. If you would require additional, please email DBMS at the email shown in the slide. Thank you for viewing our presentation.